Further discussion? Chair recognizes Ms. Kamick for 5 minutes on the amendment.
Thank you, Madam Chairwoman. I am so grateful to my colleagues, Representative Crenshaw for his leadership on this bill, and all of my colleagues here who are supporting funding for our children's hospitals. I want to reiterate again that nothing in this bill would prohibit a child with gender dysphoria from receiving proper mental and behavioral health care services. The underlying text is limited to experimental medical intervention, specifically using puberty blockers, hormone therapies, and surgeries to change a child's gender. And it was mentioned several times from my colleagues on the other side of the aisle that we don't understand this process. And so for the sake of clarity, really, I'd like to show a video, a brief interview that was conducted by an expert in gender reassignment surgeries from Oregon's healthcare system.
Madam Chair.
Madam Chair.
I object. I move that the committee adjourn. This has turned into a circus. I move that the committee be adjourned.
It's official. It's official testimony.
Madam Chair, can I just ask?
Madam Chair, without objection, I would like to.
Okay.
I would like to play this
Committee
video.
will come to order.
I was going
Motion to adjourn is not debatable, right? So I have to ask. Okay, so Ms. Kamick
Madam
controls
Chair.
the time. She gets her 5 minutes, and then we'll move to
Madam
the
Chair.
vote on the motion
Madam
to
Chair.
adjourn.
We don't want to
Thank
be
you,
held
Madam Chair.
hostage
Sorry,
by whatever it is that you
Excuse
guys
me.
are
claiming my
The committee
time.
will come to order.
So
Ms.
you'll
Kamick
have your
controls
votes.
the time. Ms. Kamick controls the time.
Thank you, Madam Chairman, Chairwoman. Without objection, I would like to.
I
play this
object.
video.
There's an
I
objection.
object. We have no foundation or basis for this video. We haven't seen it, and
It's
I
a
object.
medical expert from your side.
I object.
If we don't as you claim, if we do not understand how this surgeries work, I would like to show a video that articulates how these surgeries are conducted. I think that is completely germane to the conversation that we are having here today.
Okay. Just, excuse me. Lady will suspend. Committee will come to order. Okay, so Ms. Kamick gets to finish her 5 minutes, and then we will proceed.
Thank you. Please play the video.
So you objected to the video.
It's an interview.
Okay. Committee stands at recess. Committee will come to order. Ms. Kamick had asked unanimous consent for the committee to watch the video. There was an objection. I'm going to yield now to Mr. Pallone for the purposes of his objection.
I looked at the video, but I insist on my objection because I have to be honest, I don't even understand what the person is saying. It's all, to me, it's just almost impossible for us to understand what he's saying and how it relates to what we're discussing here. Even the authentication is difficult, so I insist on the objection, Madam Chair.
Instead of a unanimous consent, the committee, I'm going to ask then that the committee vote as to whether or not to see the video. All those in favor say aye. Aye. Those opposed, nay. No. The ayes have it.
Recorded vote, Madam Chair.
Yes, for a recorded vote. A recorded vote.
So 80% or so of my practice is gender affirming surgery. So I do facial, chest surgery, and genital surgery. But the majority of my practice and sort of where my passion lies is really genital surgery cases. So I do a lot of vaginoplasty and a lot of phalloplasty. I would just say they're expanding in either direction. So yeah, a lot of adolescents presenting for surgical intervention, but also a lot of people that are like in their 70s sometimes coming in for genital surgery, and then everything in between. But the adolescents for sure present some unique challenges. Obviously, there's great evidence supporting pubertal suppression for a whole variety of benefits. But the one thing that is very new is genital surgery in someone that has underwent pubertal suppression. Not so much an issue in someone with assigned female at birth anatomy that undergoes a phalloplasty, because we're creating something with a free tissue transfer or a flap anyway, but a much bigger issue for an individual that's undergoing a penile inversion vaginoplasty, because we use all of that tissue to basically create the vulva as well as line the internal vaginal canal. And as a specialty, those of us that do a fairly high volume of genital gender affirming surgery, we've maybe done a handful of pubertally suppressed adolescents as a field, and no one's published on it yet. OHSU we're just putting our first series together as we're kind of learning and figuring out what works. But it's really changing things because you don't have enough tissue to line the vaginal canal. So you either have to take a skin graft or take skin from elsewhere or use some artificial product. The way that we're dealing with it is by using a robot, and we're basically performing intra-abdominal components of the surgery. Using peritoneum, which is the inner lining of the abdomen, to line most of the vaginal canal. And by doing that, that allows us to use all of the remaining tissue externally to create a vulva and try to make also an aesthetic result.
So what we just witnessed was an interview last week from Dr. Blair Peters, who is a gender-affirming surgery expert at the University of Oregon's Health and Science Division. Earlier today, just a few minutes ago, our colleagues on the left said that we didn't know what we were talking about. So when presented with a video that details exactly what it means to conduct surgery on a minor for gender-affirming surgery, they left the room. They don't want the facts. And as you heard from the specialist who does these surgeries, they don't know what they don't know. They don't understand the long-term effects. There is not even published information, peer-reviewed information backing up the claims that our colleagues on the left have said. We are here today to...
So the same people that want to mutate little children and the ones that say everything's okay, it's affirming them, affirming their confusion, affirming their mental disorder. What is it that you're affirming? Well, that aside, those that say there are no side effects, it's all right, and then someone from the Republican side who says, no, this is wrong and bad. I'm going to play you a video of one of these so-called surgeons or doctors speaking about the disgusting things they do, and that it's not even verified that this is going to work for their benefit. No, the DEMS freak out. They don't want the video shown, and then when it is shown, they walk out. Their argument dies right there.